Spinal cord tumor is one of the dangerous diseases. When the tumor compresses the nerves, it can cause paralysis and more dangerously, cause death. However, the symptoms of spinal cord tumor are quite similar to the signs of common bone and joint diseases, making it easy for patients to confuse and be subjective. If not examined and treated promptly, the disease can lead to extremely unfortunate consequences. Spinal cord tumor is a condition in which the spinal cord develops tumors that compress nerves into nerve structures in the spinal canal. As the tumors grow larger, they compress the spinal cord, leading to neurological deficits in the lower spinal cord. This often causes the patient to experience numbness, weakness, paraplegia, or more seriously, incontinence. What are the symptoms of spinal cord tumors? In fact, many patients, when experiencing signs of lumbar spine pain, numbness in the legs, and difficulty walking, often think that they have common musculoskeletal diseases. However, after a period of treatment, the disease often does not improve, and even gradually numbs from the iliac crest down to the toes, making it difficult to move the legs and unable to walk. At this time, the patient goes to the doctor and is surprised to discover that the tumor is in the spinal canal. Some other cases when seeing signs like numbness in hands and feet, often subjectively considered office sickness due to sitting too much. Young age, so only perform methods such as massage, acupressure. After that, the disease progresses severely, making it difficult for the patient to walk. At this time, many patients undergo careful clinical examination with the result of spinal cord tumor. According to doctors, because the tumor in the spinal cord causes pain, patients can easily confuse it with nerve root pain because the symptoms of both diseases are pain, muscle stiffness, and compression on the nerve roots. The only signs to distinguish spinal cord tumors from other diseases are movement disorders, and the patient does not respond to conventional medical treatment. In addition, you can recognize spinal cord tumors through typical signs such as early symptoms of spinal cord tumors. When the tumor first appears, most patients only experience some local symptoms and some other symptoms, nerve root. Because these symptoms are so vague, it is difficult to detect. In addition, the disease often progresses slowly, and it may take several years for serious symptoms to appear. Specifically, the patient may experience symptoms such as sharp pain. The pain will spread along the nerve path compressed by the tumor. There will be a feeling of numbness or muscle weakness. Symptoms of later stages of spinal cord tumors. As the disease progresses, the tumors in the spinal cord will grow larger and compress half of the spinal cord, causing the spinal cord to be pushed to one side. At this point, the patient may be paralyzed on one side of the body and lose sensation when exposed to hot or cold environments. When the disease progresses to the full-blown stage, the patient will experience symptoms of disorders on both sides of the body. At this time, typical signs are often sensory disorders and movement disorders. In addition, there are some symptoms such as urinary retention, difficulty urinating, and constipation. Basically, specialists say that we absolutely must not be subjective to any unusual changes in the body, because in cases of late examination, the disease has progressed to a late stage, making it very difficult to treat, and the patient is also very difficult to fully recover. The most effective spinal cord tumor treatments. Depending on the severity and condition of the disease, the treatment method for spinal cord tumors will have certain differences. Specifically, if the patient has a mass lymphoma or germinoma, doctors may consider chemotherapy or radiation therapy. However, most cases diagnosed with spinal cord tumors require surgery to remove the tumor and relieve the compressed nerves. The main purpose of surgery is to limit the invasiveness as much as possible so that the risk of recurrence is low. Therefore, patients rarely need radiation or chemotherapy. if the patient has a tumor that appears in the outer dura mater. Because the tumor only adheres to a small part of the nerves or spinal cord, the surgery is usually quite simple. However, in cases where the tumor appears outside the dura mater, it can also grow in many different directions, causing bone destruction and easy bleeding, making the surgery more complicated. In cases where spinal cord tumors appear due to metastasis from other cancerous organs, this condition is quite complicated with poor recovery ability, and the patient's life expectancy is also difficult to prolong. Therefore, doctors will consider very carefully before deciding on surgery. In short, spinal cord tumor is an extremely dangerous disease, and its symptoms develop silently in the early stages, easily confusing with other common bone and joint diseases. Therefore, if the body shows some suspicious symptoms of spinal cord tumor such as pain in the lumbar region, numbness in the limbs or muscle weakness, the patient should go to the doctor early for timely diagnosis and treatment, minimizing the risk of complications that may occur.